We developed mentalization-based therapy specifically for antisocial personality disorder simply because it was useful in borderline personality disorder, but in effect we have a lot of people who are comorbid for both disorders. And in our clinical services, actually there was a problem with that overlap. So people who were more antisocial were actually quite distinct from those who are more borderline personality disorders. So we decided to separate them. Having done that, we of course had to have some view about what the mind states of people with antisocial personality disorder were like. These people actually have a disregard for others. They actually have a disregard for their own safety very often. They're not very interested in other people's views and perspectives or mental states. We know that they misuse sort of emotions of other people generally. They may trigger emotions and then use them or exploit them and so on. All this is described in the literature. And we think that those sorts of attitudes, those sorts of behaviours and those sorts of relational problems that they have are fundamentally based on problems in mentalising. So in fact, we used that to generate a treatment program for targeting areas of mentalising problems for people with antisocial personality disorder. I mean, we start the groups with agreements between us all, which we call a code of conduct. You know, how are we going to relate here? What's our value as individuals in this group, and what are our values that we're going to try to follow in the group? And we have a series of examples with them about how we might behave, how we might not behave, how we expect each other to behave, and we specify those, right? So we can always come back to that if it starts going wrong. That actually we simply don't do this here and so on. And they're quite good at respecting their own codes of conduct if they've generated them. Well, that's a great question, because when you first see them, they have no interest in thinking differently whatsoever. So the first task is always to actually try to engender a process whereby you're solely taking their mind states into account. You're simply exploring their views, their values, their perspective on what's happened to them, what is happening to them, their perspective on their current relationship, however they perceive it, and to take that absolutely seriously, face value, and explore it in a lot of detail and depth. And until they have a sense that you see things from their perspective, you can't do anything else at all. Once you've done that, you then subtly or gently move away to actually push them to consider others' mental states in various ways, or in fact others' emotional states very often, because they're not very good at seeing other people's emotions, or at least responding to them in a feedback system. So for example, if they see someone else is a little scared, they don't care. When actually people without antisocial personality disorder, if they see someone they're making anxious or scared, they tend to get a feedback system which alters their behaviour. So we spend a lot of time getting them to consider these sort of feedback loops, particularly about others' emotional states. And we do that now primarily in groups. And the reason for that is, of course, is that peer pressure in antisocial personality disorder, gangs for example, actually can function incredibly well. They're very good at gangs. They organise them, they have a proper hierarchy, they understand each other's roles, they know how someone's going to respond and so on. So we simply set up a gang in a sense, except it's called a therapeutic group. And then we get them to start considering each other about what they're doing, what they're like, how they see each other and so on. The low-hanging fruit that you see early on is actually their recognition of other people's emotional states. When they start in the group, they have no interest in looking at others, particularly trying to read what they're mental state might be from how they're presenting or how they're expressing something. And we focus a lot on that early. And actually, they begin to realize it's incredibly informative. That if you bother to look at people, if you bother to think, say, what's behind that smile, what are you laughing at, in a genuine curiosity, they actually begin to work out that this is quite useful, actually. They may then, of course, try and misuse it later, you never know, but nevertheless, they're very quick at picking up, actually, you can ask people things, you can check things out, you can understand what people's emotions are a little bit, rather than just seeing them as a threat or something like that. The vast majority of people with antisocial personality disorder spend an inordinate amount of energy trying to deactivate their attachment systems, if possible, because attachment creates a lot of trouble. So once their attachment systems are activated, they're in trouble of all sorts of things, of dependency, of need, of desire, you sort of mean, of other people. And that, of course, is very problematic for them because they're very self-organized. They don't like to need someone else, if you like. They're autonomous in that sense. So mostly they try to deactivate them. The problem with antisocial personality disorder individuals, they don't do it very well because they tend to be disorganized. So it bursts out all the time in different ways. So in fact, what we do with this is get them first to begin to actually scrutinize and think about their relationship processes. Just what are they like? How do they go? What happens? So we get them to do that. And we give them information about attachment and attachment processes. And then we get them to actually map them and so on. And we actually give them what we call a relational passport. It's simply a little thing about their own attachment processes, really. And they discuss that in the group. And of course, in the group, they actually are mostly activated. So their dismissive processes are activated, their attempts to deactivate are activated, if you see what I mean, and so on. And we alight on those in the group. That's one of the other focus of the group, is looking at those as they do them with us and with each other. The safe zone they step into is, to a large extent, they become less reactive to others. So they're less sensitive, they're less likely to make assumptions about other people's malign mental states. They don't assume that somebody's against them too quickly and things like that. So they're much less reactive. Once they're less reactive, they're able to maintain the stability of their own mental state, so they don't feel so threatened by other people. And they actually get better at reading other people, so they differentiate. Not everybody isn't an enemy. Some people actually are friends, or they've got benign motives and so on, and they feel better about that, generally speaking. People worry about fearfulness and reactivity for the therapist, and sense of feeling controlled or coerced or tricked or lied to, these sorts of phenomena, which are sincerely an issue. But actually, the ones that cause quite a bit of trouble in terms of therapeutic work, one is a reaction where the counter-responsiveness is actually to start minimizing events. We simply listen to these things, and gradually you begin to get the sort of sense, well, he only stabbed him once. And you say, oh yeah, so that's okay then. You sort of get drawn into this idea that certain events actually, they minimize. They say, well, it's only this. He only beat him up. And you think, oh yeah, that's all right then. Yeah, and you start generating this sort of response where things become minimized. All right. Now, that can actually happen in things like your reactions to other things in borderline personality disorder, of course, but it's quite common in antisocial personality disorder. They minimize what they do as if they're perfectly okay. The second one is actually which links, is that they use a lot of humor. And to be honest, they're the best comedians you've ever met. They draw you into this comedic sort of situation where you lose sight of the fact that you're delivering therapy, and you have these sort of great jokes being made about things, often which have a slight macabre element in them and things like that. And it's very easy. They create a certain humorous sort of interaction which actually avoids the seriousness of things. And it's easy to lose that, and you have to watch out for your counter-responsiveness down those two lines, certainly.